Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
This is so exciting for me. I have Dr. Sass Moulavi, who is the founder and medical director of Smart for Life Diet Solution book. And also we have a whole new thing to tell you, that now Smart for Life Weight Management Center is in Boca Raton waiting for you. And I personally can tell you that I have been such a great proponent of this organization, especially Dr. Sasson Moulavi and his wife, Anita. They've done great things for lots of people. But the news is Medicare can help you now to lose weight. So welcome to our show, Dr. Moulavi.
Hey, how are you?
I'm doing great. And I know you're thrilled now that you can actually be helping people who are on Medicare.
Correct. Yeah, that was actually one good thing that Medicare did, was that to include obesity as a disease, and now we can treat it. If the patient's BMI is above 30, we can treat it and we can bill Medicare. As long as the patient loses weight in the first 6 months, we can do an additional 6 months. And finally, they've realized that if we're able to get people to lose weight, we can improve their diabetes, hypertension, and other diseases. And as you know, we've had great success in our center for years doing it under people who were paying us privately. And now it opens up the access to a lot more people who have Medicare and other insurance, of course, too.
Yes. And I remember, of course, losing about 35 pounds doing that without Medicare. But I love coming into your center. And, of course, you've moved. Anyone listening, they used to be on Glades Road. They are not on Glades Road anymore. Just get your pencils out. Remember, this is Pencil Talk Radio. They are now at 3196 North Federal Highway in Boca Raton, and you can call them for an appointment, and their phone number is, and I've got it right here, 561-338-3999. That's 338-3999. Also, be sure that to get on their website, because you can order products there, you can see what they're doing, you can see how attractive Dr. Moulavi is, and the website, smartforlife.com, smartforlife.com. Now, I'm glad that you mentioned the problem with people who can help themselves to reduce all the disease without going to prescription medications. That to me is so important, Dr. Moulavi.
Correct. So in 2004, which is a while ago, but the New England Journal of Medicine actually did a study, published a study that showed that people who lose weight with under medical supervision do 5 times better than doing it on their own or with what we call, the commercial programs out there. So we know that patients who try to lose weight with doctors have access to a lot of other things that simply, your local quick place to lose weight, who has maybe some kind of a consultant who doesn't have medical training, doesn't have the ability to use certain medication, doesn't have a way to look at your metabolism, just cannot do. So at our center, when you come in, we do a very in-depth assessment of your general health, of your metabolism, of your blood work. If you have diabetes, for example, we check for neuropathy to make sure that you don't have neuropathy. We have a special machine that does that. Again, all paid by insurance. And at the end of this assessment, we create a program that works for you. You may want to do the classical Smart for Life program. You may want to do a Mediterranean diet program, which we have, which works very well. You may want to do the DASH program, or you may want to do your own program, but with the doctor's supervision. And that's what we do, and that's what we're so successful at. And simply for people to go out to those commercial programs out there without physician supervision, they're really throwing their money out, because time and time again they've shown that those programs simply do not work in the long run. And in order for you to get long-term results in weight loss, it's a long-term relationship with your doctor. And we know that we can be successful, and we've done it thousands of times. So our success has been in, first of all, I did my board certification in bariatric medicine. I also am one of the few people who graduated the fellowship program of the Obesity Medical Association, I think there's a handful of us in the whole country who's been able to do that. And so we have all the techniques out there in order to get you to use less medication, reduce your insulin needs, because all insulin does for most diabetics is make them fatter and sicker. And also, if you have hypertension, we know that when people lose 5 to 10% of their body weight, they can cut or reduce their blood pressure medication significantly. So I have taken thousands of people off their diabetic meds, thousands of people off their hypertensive meds, and I've also been able to take a lot of people off their cholesterol meds, or at least reduce the dose to a less toxic dose, and also balance a lot of people's metabolism. You have no idea how many women especially, but also some men, come to me and they never had their free T3 measured, for example. And we do that in our office, and we catch a lot of these people who have a slow metabolism because either they're on the wrong combination of thyroid medication, or they're on a thyroid medication like Synthroid or levothyroxine that needs to be converted. That's not an active medication. Your body has to actually convert it to another form, and they just don't have enough of the converting enzyme, so they don't convert it. They don't lose weight, and we do all these adjustments right at our office.
Amazing. How do you keep people motivated? Because I see when I do go into your center, people are so happy. They're jumping. Of course, Renata is a big part of that. She loves everybody, and your staff is so lovely. But so now let's say you have them on a program, and they come in, once a week?
Yes, we'd like them to come in once a week in the first month, and then once every 2 weeks after that. So first of all, we assess their readiness to lose weight, right? If I have a patient who is really ready to lose weight, we ask them, how ready are you to lose weight? And they tell me, well, I'm at 10. I'm ready to lose weight. I'm all in. And then I tell them, well, how much do you believe that you're going to be able to successfully losing weight and keeping it off? And they tell me it's a 5. There's a big difference between how motivated they are and their belief in being successful. What we do at our office is we take that 5 and we bring it up to a much higher number, because in the first week or two, patients lose significant weight. And when they see that and we show them that, then they believe in the program, and then we can keep them for the long run. Because what typically happens with most programs is people lose a nice amount of weight at the beginning, and after 2 to 3 weeks, they flat out and they don't lose any more weight. With our program, we have ways where people continue losing weight for a very long period of time. Now, all of them plateau at some point. So at some point, even on our program, they will stop losing weight. But generally, that's much later than other programs. They've lost a lot more weight than other programs. And once they plateau, we give them a very clear plan that they know that they need to come back as soon as they start gaining weight. And when we believe that they've been a plateau long enough, we bring them back on the program so that they lose more weight and we get them to the next plateau. So, for example, somebody who needs to lose 40 pounds, we generally can do that in one shot, meaning within 3 months, they'll be down. Somebody who needs to lose 100 pounds, well, we're going to get down to 40 to 50 pounds in the first shot, then they'll reach a plateau, and they'll be off our program for 2 to 3 months, and then they'll come back, we'll knock off another 25 pounds or so, and then we'll bring them back again. So it might take a year for them to lose that 100 pounds, but if they stick to it, they will. And a significant number of patients stick to it. Now, everybody wants to keep the weight off forever. Unfortunately, that does not happen. Overweight and obesity is a chronic disease, and most people start gaining weight at some point in their life. The trick is as soon as you start gaining weight is you come back to the program. There's no magic program that keeps the weight off forever, including bariatric surgery. I see a lot of bariatric patients who've had the surgery, who've had the banding or one of the other procedures, and they've gained weight because they were never told that just as a tool, and they need to keep coming back to a bariatric doctor to as soon as they gain those 5 and 10 pounds, they need coming back. A study just came out from Australia that showed that the average smoker, in order to be successful in stopping to stop, has to try 25 to 30 times to stop. With weight loss, it's very similar. You have to do it. You have to keep trying it. Once you give up, you're doomed. So all of you out there who are listening, if you've tried 20 times, well, you got to maybe try another 5 or 6 times before you get it. And please go to a physician. If you don't come to us, go to another doctor who does medical weight loss.
Well, I have to
Don't
jump.
go to the commercial programs because
Right.
the studies simply show that in most cases they just do not work.
And they're not safe. I mean, we haven't talked about that, but I just can tell you from knowing you and knowing your organization that this is also carefully prescribed, and you have to really be alert to a lot of programs out there. You have to deal with a medical doctor, but not only any medical doctor. Dr. Moulavi is board certified, trained in bariatric medicine. That means that's weight loss. So, what is the definition of bariatric medicine?
Bariatric medicine is the field of medicine that deals with overweight and obesity and its related conditions. So there's a lot of psychological factors, there's metabolic factors, there is also eatings and habits, right? So we are trained in assessing metabolism, whether it's thyroid disease or insulin resistance or one of the other resistance, leptin resistance, for example. We're also trained in assessing the patient's psychology to find out what is the root cause psychologically of the patient's not being able to lose weight. Sometimes it's childhood trauma. Sometimes it's just patients like to eat, right? There's a big variability between them. We also are very well trained at thyroid disease. We're very well trained at diabetes. We treat lots of diabetics in our clinic. We're very trained at manipulating cholesterol and dealing with cholesterol because it's complicated. It's not as simple as people think. And we're trained in cardiovascular disease and also peripheral neuropathy disease. That are all the complications of obesity. And the other big thing we're trained in is obesity has another toll. Overweight and obesity has another toll, which is there's a psychological price that every overweight and obese person pays, which is they're unhappy with themselves, they have a lot of guilt, and they have a very bad relationship with food. They have a love-hate relationship with food. We're trained in taking that equation and turning it around so that relationship changes very quickly. And sometimes they don't have to lose a lot of weight for that relationship to change.
Well, what I wanted, this all is so pleasant, and I hope our listeners are really listening hard. In Boomer Times, you'll see in our June issue, you'll see an article that he wrote, and also you'll see the idea that if you call 561-338-3999, you can really be in touch with Smart for Life Weight Management Centers, and it's Medicare can help you to lose weight. This is something very new here, and so for Dr. Moulavi, and I have to say that the cookies, I always call it the cookie diet for me anyway. I love those cookies. When other people at night grab for all those other stuff, I grab for my chocolate cookies, and I'm sitting here at the radio station right now with my Smart for Life Smart Shake. It's chocolate. I absolutely love it. I put cinnamon in because I know cinnamon's so good for me, but I'm really addicted to Smart for Life, and it does sometimes. I do gain weight, then I take it off, just as Dr. Moulavi said. But I don't want to shorten this conversation till I have something. I think of Dr. Moulavi every day, and why is that? Because I have his book. It's called Smart for Life Diet Solution. It's how an overweight ER doctor lost weight and kept it off, and how you can too. You really tell all in this book about yourself, and I just love this book. I don't know if you're selling enough of these copies.
Well, we sell. We don't. I don't make it. Part of our. But yes, we do sell them. I believe it's available on Amazon and Barnes and Noble and a bunch of other places. But it's really my personal journey with overweight and obesity. I was 40 pounds overweight myself. I was in fact so overweight that when I used to run in the hospital up to the floors to run a cardiac arrest, I was too out of breath to call the code. Call out the drugs that the nurses have to give the patient. And I had the nurse do it for me for the first couple of minutes till I caught my breath. And I dealt with overweight and obesity, and I still suffer from it, and I gain weight at times. I have an addiction to pizza. And I fight it all the time. And every year I gain, 5 to 6 to 10 pounds, generally after the holidays. I get back in the program and I knock it off. Now, the reason that we use cookies and bars is because it makes it very simple to the patient. The patient walks wakes up in the morning, they have a bar or cookie that has all the ingredients. It has, complex fibers. It has protein. It has flaxseed. It has fish oil. It has fibers that suppress appetite and protein that suppress appetite. And it buffers all the sugar, and it still tastes good. It doesn't taste like a typical diet food. And we also have two lines right now. We have Smart for Life, and we also have Straight Medical Labs, which is the medical-grade food, which we use on a lot of our patients, but especially in our diabetics. It has, for example, our bar has 20 grams of protein, 8 or 9 grams of a super fiber, which is equal to multiple times the regular fiber, and only 3 to 4 grams of sugar. And they still taste very good. So we've been able to do that because we own our own manufacturing facility. We own our own research facility. We're continually doing research on product development, what products are working well with the body, what are causing less inflammation, and also at the same time making sure that the product tastes good. Because if a product does not taste good, patients cannot stay on them in the long run. So I've been eating the bars for about 3 or 4 years. I've been eating the cookies for 10 years almost. I can tell you that a lot of patients in Boca have been eating our cookies for a long time. They're healthy. This is not a crazy diet. There's a lot of science behind it. Science has shown that eating small multiple meals that have at least 5 grams of protein in them with high in fiber is the way to go. And so we just designed a program around our literature that supports our science.
And of course, Dr. Moulavi right now calling in from your manufacturing plant. So tell me what you do there.
So I really supervise the new product development and all the research. We have a very good manufacturing team, IB certified bakers. Actually, we won Manufacturer of the Year in 2013. So I'm really here looking at new formulation, new products, a little bit of quality control. We right now are very heavily into producing products that are causing leptin sensitivity to increase to fight with leptin resistance. We've done a really good job with insulin resistance with the product. Now we're going after leptin resistance. And we just came out with Dr. Ari Sofer, who's a cardiologist in Aventura and has his own show on NBC, with a Mediterranean diet that we developed together. And that Mediterranean bar has, fish oil and wine and resveratrol, and it basically also has olive oil in it. And that olive oil is, as you eat the bars 6 times a day, instead of getting like a big dose of olive oil, which a lot of people do in the salad, if you really look at the way they did it in the Mediterranean diet, they actually had olive oil all day. They had olive oil with their breakfast, they had olive oil with their lunch, and that continuous olive oil going into your bloodstream was the key to the long-term success. So with the bars, you get that continual olive oil going into your system. Because if you eat a big salad at night with olive oil, okay, you got a lot of oil at night and you got that dose, but what about the rest of the day? You still need that olive oil in your bloodstream. So we've been able to develop that, and it's been extremely successful. We've developed a dash bar, and right now we're working on a vegan bar that will be out probably in the next month. So we have a lot of exciting things happening.
You amaze me, Dr. Moulavi. I don't know how you have time for all this, but I would just add a little personal thing. My son and his wife had triplets, and she's from Italy. And she took the baby food, and I noticed that every jar she put olive oil in before she fed it to them, and I never had seen that, and I never said a word. So she must have known something.
Smart cookie.
Smart cookie, that's right. We're all smart cookies because we go
right.
there. And I wanted to tell you that I just came back from a trip to New York, and I went with probably about 10 cookies in my luggage. And when other people were kind of scrounging around looking for this, I just opened my little package, ate my cookie. I was perfectly fine. I even had it when we went to the theater. I am addicted to the cookies. And of course, all the other things. The soups, we didn't talk about a lot of the other things that... So you really have, for me anyway, you have been the best thing that could have come into my life. Because years ago, I used to go to Weight Watchers. I did things like that. But you're right. You never stay on them. They're too complicated.
Correct. And Weight Watchers is actually one of the good ones.
I know.
They're not like a doctor, like a physician who knows your blood work, who examines you, who knows where you need to go, you also have a lot more, if I kick you in the butt versus, somebody at Weight Watchers, trust me, my kick in the butt is going to be a lot more powerful for you psychologically, and you want to improve yourself to your physician more. People just do better. We see it all the time, and we hear it all the time. So, you're a model patient, Anita, because first of all, you come back. As soon as you gain a little bit of weight, you come back. You've been able to maintain your weight very well. You look years younger than, and what you've done is by losing weight, you've been able to actually slow down the aging process, which is what happens. So you look great. And those are the kind of patients who are very successful on our program. The ones who keep coming back, the ones who are not embarrassed to come back and say, look, I know I lost 40 pounds, I gained 10, I need to get back on the program.
But actually, thank you very much. But I have to say that it's not hard to stay on with the cookies that you make. Those chocolate cookies, it's dark chocolate. And when you see the grams, sometimes I have a cookie and I think, if I'm not mistaken, they're 10 grams or more in a cookie. That's like of protein, 10 grams. Your bars have a lot of protein.
Yeah, well, our bars have more protein than, for example, a McDonald's hamburger, right? And not only that is that you learn a lot in our program, right? You learn that kale, 50 calories of kale has almost as much protein as 50 calories of red meat. 50 calories of kale has 4.3 grams of protein, and 50 calories of meat has 5 grams of protein. So it's almost the same, but the kale comes with a lot of great micronutrients. It comes with fiber, while the red meat comes with a lot of garbage in it. So, people learn to make those choices. And we introduce some of those products into our products. For example, some of our products have kale in them so that people know it. And then we also ask people to add green leafy vegetables to their diet so that they're getting more protein and more fiber in that form.
Well, I want to go back to your book again because it reminded me I know Renata, as you say in your book, you do give her a lot of credit for the recipes, and they're fantastic. So when you buy this book, and you should either go there, you can buy it there, just go to the center. You can buy this on Amazon or some other place, but go to the center, get to meet all their wonderful staff. Maybe if you're lucky, you'll get to meet Dr. Moulavi. If you join the program, you will definitely get to be with Dr. Moulavi. But it's called Smart for Life Diet Solution, and you'll see a whole, maybe there are 50 pages of menu of recipes, lots of fabulous recipes. I have to thank Renata a lot for what she did here. But tuna, cucumber boats, and tofu, and turkey quiches, and oh my God, it is a wonderful, wonderful book. And I keep telling you, I keep it, pardon the expression, in my bathroom, right by my toilet. So in the morning, I get started, I weigh myself, and I get some more ideas from your book. I wanted to go back to something you said about medication. See, Weight Watchers and even other, sure, it may be a very good program, but there's no doctor there. So I see in your book, you talk about sometimes the medication you're on is causing you to gain weight.
Correct. And there's a list of medication in the book that is causing weight, and a lot of times what we need to do is we need to either stop it or change it and replace it with another medication that doesn't cause weight gain. Because unfortunately, a lot of doctors who don't specialize in weight loss are just unaware of that side effect because it's complicated. And I'm not blaming the doctors. There's a lot of information out there. Medicine has become so complicated. There is just so much information out there that there's no way that, a doctor who specializes in one thing is going to be able to know everything. So we know those medication, and that's one of the things that we do is we assess your medication, what's causing your weight gain. So if you're on a medication for depression, for example, we know that the best in class for weight loss is Wellbutrin. So we try to see why can't that patient be on Wellbutrin? Why are they on another drug that may be causing them weight gain? And that applies to a lot of other diseases, of course. So that's what we do every day. Now, another thing, if anybody wants to come to the center, they can come in, ask for free consultation. We'll do a very sophisticated BMI on you where we assess multiple things, your amount of muscle you have in your abdomen, the amount of muscle you have. It's completely free of charge. It's part of a free consultation. We can tell you how much muscle you have in your upper body, lower body, how balanced you are. your water in your body, your intercellular water, your extracellular water, the amount of fat you have, and so on and so forth.
I am so happy you've done this.
Right. So that machine, this is a machine that's, there's not a lot of places in Florida who have this equipment. We're one of them. We, in fact, have multiple equipment that does that because of the amount of volume that we do. Because we do, besides doing regular medicine, we have a lot of patients come to us for regular medicine to see my nurse practitioner, Brenda, who's excellent. So you can come in, get that assessment, and at least know where you are. And when you're ready, you can come back and do the program.
Well, I know I've been there so many times, and I've seen the people. I've seen how happy they are. They do feel good. It's hard not to get on the program. Of course, I keep talking about the cookie program, but now that you can have people who are visiting you as their doctor and have Medicare pay for it, I was so thrilled to hear that. And you ought to go and see their beautiful new center, which is located at 3196 North Federal Highway in Boca Raton. Again, the number is 561-338-3999, and you can actually order Smart for Life products on the web. But I'd rather you go there and first meet everybody, but the website's smartforlife.com. I was just looking at my chocolate drink, which I always bring this because as I'm on the radio show, I get, it's a lot of work here, and I see I have a chocolate drink. It's 11 grams of protein, and it's delicious. It's just a little bottle, and it's wonderful. And you see, I have no hunger now, where we have this vending machine. Before I do that, you go get pretzels, potato chips, all this crap. But when you take this, you are so happy.
Correct. And it's only, I believe, 110 calories or so you're getting quite a lot of protein for the amount of calories you're eating.
Yep. Yeah, I'm a good doobie. I love this, and I'm really so happy that you're going to start to do these radio shows, and hopefully we're going to start to do some seminars, Dr. Moulavi, there at your center, because we got to expose, pardon the expression, we're going to expose you to everyone here. Thank you so much, Dr. Moulavi, and just keep doing it, and I'll keep eating them.
Anita, thank you so much. All the best.
Thank you.
And everybody, if you're overweight, do something about it. Don't ignore it. It's important.
Right. Thank you. Live longer. Thanks, Dr. Moulavi. Bye.
Bye-bye.